Hi, I'm Enchanting Newbie Annette. Welcome back. And if you're new to my channel, welcome. So everyone, it is here again. I looked on at the news just this weekend, and I see that the monkeypox outbreak now has 3 Californians affected. So we all need to be vigilant, even here on the East Coast, everywhere in the US. Now remember back in the summer of 2022, as the world was dealing with the aftermath of the 19, remember that? Of course you do. Another virus was starting to make headlines, the monkeypox. So even though this is not a new disease, it's having been known since the 1970s actually, but it had a sudden rise again in cases outside of endemic areas, which really sent shockwaves through the health systems across the globe, and particularly through the communities that were already vulnerable, including, Black and Brown communities here in the United States. Now, in California, 3 individuals right now have tested positive for this V virus, and their experiences highlighted just how urgent it really is to educate and protect ourselves from this disease. So, if you're not familiar, you're probably wondering, what is monkeypox? Now, first, monkeypox is a rare disease and is caused by a monkeypox V virus, a member of the same family as the smallpox. So it can lead to these symptoms, like you're feeling like you have the flu, swollen lymph nodes, and even a very distinctive rash. It's not like a regular rash, like, hives, or if you just have a little allergy. It's very distinctive. And it usually starts on the face and even the genital area. And of course, if you have it in these areas, it can easily spread all throughout the body. Now, the good thing is it's not fatal, but you definitely will have severe pain and discomfort. And from what I've been reading online, in many cases, if it's long term that you're dealing with this virus, you can also have scarring. So the recent outbreak does raise concerns about how quickly it can spread. So, it can spread in many different populations and different communities. So you're probably wondering, like I was, like, how did these 3 Californians get it? So these people did contract, the monkeypox. I'm talking about the ones that contracted in 2022. So they were very vulnerable, whether they realized it or not. They were from different areas in California. We know California is a very vast state, huge. And they contracted it through close physical contact. However, it is important to note, according to online reports, that monkeypox doesn't spread through just casual contact or even just breathing like 19. It does require like more intimate skin to skin contact. And the virus, when it's active, there's definitely rashes and even lesions present. And I have seen the photos of really big, like hard looking bumps, you know? So, like chicken pox, but you have to think about those bumps being even bigger, very big, very, very hard to look at, in my opinion. So now the CDC YouTube family later clarified that the primary mode of transmission was through prolonged contact with infectious source, bodily fluids, and even respiratory droplets from a person who has symptoms, especially when they're in that stage when the rash and the sores are noticeable. So please be observant, when you're in the public. This is what I do, everyone. I always carry rubber gloves with me When I'm on public transportation, I still use them in order to, like hold on to the poles, push the doors, open doors, in the bathrooms, um, whether I'm at the faucet, but anytime I'm in the public and I have to touch anything railings, I put on my gloves or use tissues, but try not to have your hand on these items. If you can, if not, have your hand sanitizer, use a lot of it. Wash your hands with soap and water, warm water afterwards. And again, if you're in a tight public space around a lot of people, be observant. Notice if anyone has any type of rash, you know, on anywhere on their body, like their neck, face, hands, anything that's exposed. You have to be vigilant. But it also means that people who had close interactions, especially sexual contact, were definitely at higher risk. And for these three Californians, their cases are linked to these type of interactions. So it's crucial, everyone, to be very vigilant. Not only when you're having you know skin to skin contact, but anytime. So monkeypox can spread through any kind of prolonged skin to skin contact. If you're sharing like bedding, your sheets, towels, hugging someone. Definitely if you're hugging someone with that virus or sharing any of these things, you can be at risk. That's why it's so important that when you're using utensils also, they have to be thoroughly washed. So be careful, even when you're going to restaurants, if you're using those type of utensils or, even the menus. We know that menus at restaurants can be very filthy. You may not even see it, but it's good if you can even bring your own Clorox wipes. And even when you're on the train, even when you're on the plane, to go to sit in the seat, wipe things down. So be very careful of any items that could be potentially contaminated with fluids from someone who is symptomatic. So we know this is very important to communities. You know, every single person needs to think about this and be observant. Doesn't matter, this virus, it doesn't care about your zip code, your race, ethnicity, or sexual orientation. It definitely spreads through contact, plain and simple. And especially in communities that face disparities in healthcare, access to education, learning about this monkeypox is very crucial. And too often, many people in, communities where they don't have access to healthcare or, funds, they're often left out of the conversation until after the fact. Everyone needs to learn about these new health threats. So let's share this information, make sure that it's filtered to everyone before the damage is done, YouTube family. And the truth is, this outbreak definitely can hit very hard and fast. Even though it's not well known as a virus such as 19, but we have to think about how quickly it can spread and protecting ourselves. And especially if you have young ones around you, children, we know that they're playing, they're sharing, they're talking very close to one another. Even in school, as it's easy for kids to catch colds because they're socializing, which is what they should do. And of course, as children, they don't usually know how to just sneeze in their armpit or, in the crook of their arm or, always use hand sanitizer, wash their hands afterwards. They even have runny noses. But be very, very vigilant and, speak to the teachers about it as well, just to have a heads up. I know as a classroom teacher, when I was a classroom teacher, when, students had, severe colds, if they were always sneezing, if they had like a lot of mucus buildup, if I can hear that, very dry cough, you know, a lot of infection. You can tell in the mucus. Definitely, I would send that child to the nurse very quickly and speak to the parents about the importance of that child staying home for even, 1 or 2 days and going to the doctor, making sure that the doctors can evaluate that child. So, everyone, the good news again is monkeypox doesn't spread as easily as 19 or even the flu. However, being close, having that close physical contact with someone who's infected, you can definitely catch it. And people who, are playing sports with other people, they have to rely on using something that someone else, you know, has used, whether at work, for example, and using different resources, touching something that someone touches, you have to be very vigilant. Have your hand sanitizer, your gloves around you, wash your hands very readily. You know, it's it can still be very highly contagious in the right circumstances, especially if someone doesn't even realize that they are infected. They're going about their daily lives unknowingly passing it on to other people. So everyone definitely keep, educating yourselves on these symptoms, such as having a fever, chills, swollen lymph nodes, having a rash. And if you think you're infected or if someone else is infected, it is so important to isolate yourself until you can get tested and avoid contact with others. And if you think that you have this virus, if you had a close contact with someone who's infected, consider getting tested. And of course, keep your immune system strong, with good exercise, good nutrition, plenty of rest. And what I do, especially now that it's fall, I usually like to have my, concoction, which is fresh lemon, fresh ginger, basil, fresh, you can have turmeric in it as well, fresh garlic. Make this into like a huge tea. Put cayenne pepper as well, any other kind of herbs. And I usually drink that throughout the day. Really helps to prevent me from getting a cold. And another protection, many people do take the V. I'm not going to say the word, the smallpox V, to protect against this monkeypox. And many health departments, you can go there, make an appointment as well, especially for people who are at high risk of exposure. If you're working around a lot of people, even especially if you're working around amongst children, if you're in the healthcare industry as well, these communities where you have a lot of people around you, very important to prevent spreading and preventing, an illness. So definitely, everyone, the key to stopping the spread of monkeypox is awareness, vigilance, taking action. And this outbreak, which is in California, is certainly a wake-up call for the entire country, especially for people who are not even aware that they could be at risk right now. These viruses, they thrive in people who don't understand how they spread and who are not given the tools to how to protect themselves. Okay, so every single person needs to be very vigilant. And people who are in the Black and brown communities, if you have a disadvantage such as not having access to health care and health education, make sure you're online, looking at the news reports and reading information as well. Whether you're in any community centers, barbershops, beauty salons, if you're at a spiritual place or whatever, have open and honest discussions about these risks and how you can protect one another. We definitely have to take this monkeypox seriously, okay, because it's already spreading. We have to stay informed, and really support one another, and, please share this video because three people have it on the West Coast. People who are traveling, you really have to protect yourself as well because, have a heads up and try to find out, what is happening in different states, and especially if you're flying out the country. If you're doing international travel for work or casual, leisure, be vigilant and know what is happening, especially regarding your health. Everyone needs to be aware and being responsible. So please leave your feedback below. I would love to hear from you. And thank you all for watching. Please like, share, and subscribe to this channel. Stay safe. Stay vigilant. Have a great day.